I'm Lou Carta of the Middletown Health Department, and this is Healthline. Your liver, it's the largest organ inside your body. It helps digest food, store energy, and remove poisons. But over time, when fat builds up in your liver, it can cause a condition known as fatty liver disease. Donna Sciacca is here to explain what causes fatty liver disease, who is at risk to develop it, and how fatty liver disease is diagnosed and treated. Welcome to Healthline. Returning to our program once again is Donna Sciacca. She's been here a few times. She's the Community Outreach and Education Manager for the Connecticut Division of the American Liver Foundation. Donna, it's been a while, but thank you for coming back to Healthline.
Thank you.
And we've talked about your liver, not your liver, but everybody's liver in the past. And today we're going to talk about a specific problem called fatty liver disease. But let's talk about, in general, to start off, why is your liver so important?
Well, it's a vital organ in the body, and it actually performs about 500 functions, and I can't even list them all, but it's a real protein factory. It also helps with people's ability to clot blood. So if you have an injury and you form a scab, it's your liver helping because of clotting factors. It helps detoxify our system. It produces bile, which aids in digestion. It helps our immune system stay strong. So it's a hardy organ. It can take a lot of abuse. It can regenerate, but once you get past the point of no return, basically, which is cirrhosis or hardening of the liver, because it does so many things, overall health will decline if your liver fails. So
up until that point, until that condition happens, the liver can regenerate. It's the only organ, I believe, that can regenerate.
Other than our skin, which is regenerative. But, there's a lot of leeway. So if somebody is in early stages of liver damage and you address the cause of the problem, many, many people can have that issue reversed and you can go back to healthy liver again.
All right, let's talk about the specific problem of something called fatty liver disease. Explain what that is.
Well, a normal, healthy human liver is supposed to have some fat in it. So for that 3 to 3.5 pound liver, a 5 to 10% composition of fat in the liver is normal. When someone has fatty liver, the composition of fat in the liver increases. And as that happens, your liver, which is normally a nice reddish brown color, actually can start to physically turn yellow from fat buildup. So if you have fatty liver, that's insult to liver health, but it can also progress to another condition known as NASH, which stands for non-alcoholic steatohepatitis, where in addition to the fat, now you're starting to experience inflammation of the liver. And this inflammation can be the path that leads to the development of cirrhosis.
What causes the liver to become fatty in the first place?
Well, there are lots of different causes, actually. So if you have fatty liver, there can be fatty liver associated with alcohol abuse. There can also be fatty liver as a result of some medications that people take. Fatty liver can also have a genetic component, but by far what we're seeing a lot of is what we abbreviate to NAFLD, which is non-alcoholic fatty liver. And NAFLD occurs in people who drink little to no alcohol, and there is a huge correlation between the development of NAFLD and obesity with type 2 diabetes and high cholesterol and high triglycerides.
Is this something normally a doctor would test for during a routine physical, or is there a special requirement that has to happen?
Well, when we have a routine physical, if they're doing blood work, they may be checking liver functions and liver enzyme levels. So if liver enzyme levels are elevated, that's an indication for further investigation as to why that's happening. Now, the thing with fatty liver is about 30% of people who have fatty liver have normal liver enzyme levels. So it's kind of a tricky diagnosis. It's what's called a disease of exclusion. If you do present with elevated liver enzyme levels, usually the doctor starts to do a little more homework on what could be causing that. Maybe they check you for hepatitis A, B, or C. They're always going to do a medical history to see what's going on there. And then depending on what those tests bear out, they can start weeding out what's going on. And some people find out that it's fatty liver in the end. That actually happened to me, so I have a little firsthand experience with this.
Wow, interesting. Is this something new? I've never heard this term before, and I'll bet a lot of our audience hasn't heard it either.
Well, I don't think it's new. I think it's been around for a long time, but we just didn't know about it, much like, hepatitis C has been around for years, and we didn't really identify what it was until the 1980s. So what we're starting to see, though, now that we know what this is and we have a better understanding about it, we're seeing more people being diagnosed with it. And unfortunately, Some people are truly taken by surprise with the complications because most people with fatty liver don't have any symptoms. So we actually have met people who have gone into liver failure without even knowing they had a problem.
Wow, that's incredible. And so really the first sign of anything going wrong would be that blood test, but not necessarily.
Right, but that is certainly a good indication that there's something amiss in the liver.
So what happens? You're feeling good, your blood test is, it's
little
okay,
iffy.
it's a little iffy, but what progresses? What happens?
Well, again, it depends. Now, I have some numbers here, and I hate to throw numbers around, but I think this is helpful to understand. So if someone has fatty liver, and I'm just going to give some numbers here, we have a population in this country of about 329 million people. So about 35% of those people have fatty liver, and that translates to over 115 million people. So for those people, fatty liver may just stay fatty with no complication. But there is another percentage of people, which is 3 to 12%, which translates to over 3,450,000 people, who can progress to this NASH. And that's the problem, because if you're in that population that progresses to NASH, now you've opened the door to the potential development of cirrhosis. Once you have development of cirrhosis, you're at risk of liver cancer. And then there can also be liver failure and the need for a transplant. So things can get pretty dicey if you're in that population that progresses into NASH.
You're listening to Healthline. Our guest today is Donna Sciacca. Donna is the education manager and a community outreach manager for the Connecticut division of the American Liver Foundation. And our topic is fatty liver disease. And this is just really astounding me to hear these numbers for something that is not well known by the public. Is this something that's genetic, perhaps? Do you know?
There can be a genetic component. There are some people who don't fit the typical profile of someone with fatty liver, which would be the type 2 diabetic or someone with obesity. There can be people who are appearing very lean, who don't fit that profile. So we're starting to see genetic research that's indicating some people may have a little bit of a leaning toward this or the development of cirrhosis with any disease.
How about traits such as age, gender?
Women tend to be affected more than men. Hispanic populations have a little bit of a higher propensity for this. Children can get it. So when we talk about that population that's affected, those millions of people, children between the ages of 2 and 19 are being found to have fatty liver. And again, we're seeing obese children. We're seeing children with pre-diabetes. We're seeing children with pre-hypertension. If you really look at the diet that we have in this country, it's tough. I mean, these kids, adults as well, but I do a lot of school education, and the foods that the kids are eating, whether it's just preference or financial, ability to buy healthy foods, it's not helping our health in this country.
How do we compare to other countries?
That I can't tell you. I honestly don't know the answer to that, but I know in this country it's considered a potential epidemic. When you've got 30 to 35% of your nation's population estimated to have this illness, that's a big deal.
Is the medical community, I know they're aware of it, but is this something that they're really paying attention to?
Well, that's a great question. And best as we can determine, primary care doctors and internists, they're certainly aware of the condition, but they're so busy managing the high blood pressure, the diabetes, the high cholesterol, that when they have patients with fatty liver, it's sort of like because there's no medication for it right now. It's a behavioral change. There's no FDA medication. I think there's a bit of a loss as to what to do for people other than advise them about following their medication regimen and lose some weight and try to get some exercise. And behavioral change is the hardest thing of all to do.
Will that actually reverse it or slow it down?
What I'm being told is that a 5 to 10% weight loss can actually help reduce fatty liver. So if you were somebody who is morbidly obese, I'm not sure if that would make a big difference. You might have to investigate more of a weight loss. But 5 to 10% weight loss we're seeing does help a little bit. So it's something to strive for.
And you mentioned fatty liver disease can progress to something called NASH.
NASH, correct.
Explain that again. And tell us what that really means.
NASH means that it's non-alcoholic steatohepatitis, which means inflammation of the liver.
And that's hepatitis. That's
the word hepatitis means inflammation of the liver. So once somebody moves into that progression of NASH, now you've got potential complications that can occur, including cirrhosis and liver failure and liver cancer.
Is this something, you see the ads on TV all the time for certain medication that can cure hepatitis? Does that apply to this, or is that something totally different?
No, that's a viral hepatitis, so that would be hepatitis C. So we have to just look at the word hepatitis simply means inflammation of the liver. That can have numerous causes, including the NASH.
And there's various types of hepatitis, too.
Correct, yeah.
As well as that. Tell us about a special event that's coming up later in June about NASH.
Well, it's International NASH Day, and it's an awareness-raising promotion, basically. It's June 12th. So, there should be online information, certainly on the Liver Foundation's website. But it's just to raise the awareness about NASH so that people can understand it a little bit better. And if you fall into a risk category for fatty liver, if you have type 2 diabetes, if you have obesity issues, if you have triglyceride issues, if you've ever been told you have something called metabolic syndrome, and if you have a bit of an issue with alcohol consumption, again, excess alcohol consumption can cause fatty liver as well. We urge people to ask their doctors to do the proper testing for them to make sure that their livers are functioning well before they wind up in a predicament where the damage is so severe that there's no turning back.
So again, if you went in for a regular annual checkup with your doctor, they would not specifically check for this? Again, just explain that a little bit further.
Routine blood work, they might look at liver enzyme levels, they might look at general organ function. But again, if you're in there and you fall into one of these risk groups that I'm talking about, it would behoove you to just mention to your doctor, gee, I heard about this fatty liver, can we talk about it because I have some of the risks? And that might spur additional testing. If problems are found beyond blood work, they might want to order things like MRIs or CAT scans, ultrasounds to see if there's anything going on in terms of inflammation, where they can get a picture, basically an image of your liver, and then they could take it from there.
Does it come to a point where somebody might need a liver transplant?
Oh, yeah. I've known people who've had to have that occur, and had they not had that transplant, they would have unfortunately passed away.
Tell us a little bit more what you think is coming down the pike in terms of treatment for fatty liver disease, or just any other types of educational programs. What's going on?
In terms of medication, things are in clinical trials, but right now there is nothing that's FDA approved. So I would urge people to talk more with their doctor about that. What I would also say is that there are a lot of products that people may be interested in investigating, such as liver cleanses or liver detoxes. And I don't want to badmouth these things, but just understand that things that are supplements or cleanses or things of that nature are not regulated by the Food and Drug Administration. So anything that you want to take for any sort of condition, including any liver health, really should be discussed with your physician. That isn't something that anybody should just go off and start taking, because certain things can actually create more problems than solve them. So in terms of education, the American Liver Foundation does do educational programming throughout the year. We are always happy to come in with a speaker. If you have an interest in your group or your organization or your company, we can do that. And we are in talks with a couple of venues right now for some fatty liver education. That would be on our website when they are confirmed.
And if people want more information, how do they get a hold of you, your website, all that good stuff?
The American Liver Foundation website is liverfoundation.org, which goes to our national website. And within that site, there's a drop-down where you can select Connecticut. And if you go into the Connecticut site, you will find a list of our Connecticut programs that are upcoming. People can also call our helpline, which is 1-800-GO-LIVER. That's 1-800-465-4837. And you can ask specific questions that you may have of the folks who staff that line.
Donna Sciacca, thank you for being our guest again on Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.